Hey, good morning, everyone. We're going to get started now. There's about 130 of you or so in the room. We're expecting 350. That's how many registered. So you'll be hearing bings in the background as we go along, as we let more people in. Thank you for joining us today for the virtual launch of the 2026 Alice Report here in Westchester and Putnam counties. For those that don't know me, I'm Tom Gabrielle. I'm the president and CEO of the United Way of Westchester and Putnam. As a reminder, this webinar will be recorded. All participants are muted, so please ask any questions you might have in the chat box, either during the presentation or during the Q&A at the end. And finally, the 2026 Alice Report, links to the website, and any salient materials will be emailed after this webinar concludes. I'm delighted to welcome you here today for our 2026 Alice Report webinar here in Westchester and Putnam counties. Next slide, please. I'm joined this morning by two of my esteemed colleagues who will lead much of today's discussion. They include Avery Zuvik, our Chief Impact Officer, and Dante Hudson, our Chief Operating Officer. Together, we are privileged to share with you data from the 2026 Alice Report across Westchester and Putnam counties. Some of the data presented will be from 2024, which is the most recent date available for this study. Next slide, please. The Alice Report is brought to you by the United Way of New York State and is paid for in large part by local United Ways like ours throughout the state. It was created in partnership with United for Alice, a driver of innovative research and action around financial hardship for Alice households. Alice, if you don't know, stands for Asset Limited, Income Constrained, and Employed. The Alice movement was originally developed by the United Way of Northern New Jersey and has spread to more than 40 states and the District of Columbia. Next slide, please. The Alice Report is designed to be shared with various stakeholders to inform policy and promote positive change for families struggling to make ends meet because they are living paycheck to paycheck. It also reveals the true cost of living and helps guide policy and advocacy and community investment. Thus, we encourage its use and dissemination. But unfortunately, I have to give a quick disclaimer. Please don't misrepresent its authorship and sources of data therein, and pass the research off as your own. It only leads to questions of accuracy and integrity and does a disservice to the dozens of individuals and United Ways that worked hard to create this information. Thus, if you're going to use the Alice Report publicly, like post it on your website, share it with your constituents, etc., we kindly ask you to please say it's a United Way Alice Report. You don't have to ask our permission. I'm going to repeat that. You don't have to ask our permission. Just please attribute it appropriately. Don't take our logo off and put your logo on. Don't claim it's your Alice Report, things of that nature, because all of this is, after all, trademarked. Next slide, please. Today's webinar would not happen without the promotional support of more than a dozen partners from across our area. They include the incredible organizations and programs listed on the slide on the screen. Thank you so much for your help, each and every one of you, in promoting today's webinar. Next slide, please. So today's agenda is an ambitious one featuring a lot of data. We're going to explain who Alice is in our communities, how much it costs to survive, where Alice lives, what their demographics are, and so much more. Next slide, please. But before we begin, I'm going to level set for a moment. The data we're going to present is shocking. Not surprising if you've been paying attention to the economy and the affordability crisis many in our community and every other community, frankly, are facing. The facts are the facts. Our economy is simply not working for the majority of Americans. It is not working for Main Street. That's not a 2-year statement. That's not a 6-year statement, and it is not a political statement. And you'll understand why in a moment. Our 2026 Alice Report shows that in Westchester and Putnam, 41% of our neighbors are now living in poverty or paycheck to paycheck. That's up from 39% last year. And since 2010, when we first started publishing these reports, we've seen a 50% increase in the number of families living paycheck to paycheck, and a 33% increase in the number of families living in poverty here in Westchester. For Putnam County, those increases are 12% for the number of families living paycheck to paycheck and 27% increase in the number of families living in poverty. That data, although not exact, is similar across every state in this country and in every other ALICE report. That's why this is not a political statement. This is an economic statement. The primary reason for this disparity is that the costs of goods and services have far outpaced wages. We know this intuitively with big ticket items like cars and homes and college education. All cost proportionately more today than they did 20, 30, 40 years ago. But smaller ticket items, basic needs items, things that you're going to see on this ALICE report, have increased too. For example, food is up 200% over the past 10 years, and housing costs and utility costs are up 89% over that same time period. Wages are not up that percentage. So that's the space we're going to begin today's webinar from. Next slide, please. So it's my pleasure to introduce my dear friend and colleague, Avery Zuvik, Chief Impact Officer here at the United Way, who will take you through the numbers. Avery, take it away.
Thanks, Tom, and thanks to all of you for being here for this important discussion. I know when we say data, we sometimes can get maybe intimidated, so we wanted to start with a few takeaways that you can keep in mind. We are going to throw a lot of information and a lot of numbers at you, but here are some of the high-level points and the themes from today's presentation. As Tom mentioned, 40 to 41% of our neighbors are struggling to make ends meet, and we'll get a lot more into what that number means. Again, some of this Tom already covered, but we'll keep talking about it. The number of households in that percentage continue to increase as our population increases. Costs are outpacing wages, and this burden is not distributed equally. And different demographic groups, different geographies are impacted differently. Next slide. So as Tom mentioned, ALICE stands for Asset Limited Income Constrained Employed. And what that means is that these people are working, yet do not make enough to cover basic expenses. Sometimes they hold multiple jobs, sometimes they work part-time, gig jobs, but unfortunately the income that they bring in is not enough to pay their bills. And again, this is 40% of our neighbors who are living paycheck to paycheck. Because this group makes more than the poverty level, they do not qualify for safety net programs often. So while they're struggling, there aren't as many resources for them as someone who is technically in poverty. And this is important. These are people who we, in this room, many of us have been ALICE, might still be ALICE, or know ALICE. ALICE is the person who rang you up at the grocery store, could be your driver who took you to the train station to get to your job, could be the child care provider who's looking after your kids while you're working. ALICE is all around us and is really many of the occupations that we consider essential, yet ALICE is forgotten and sort of left to figure things out on their own. And just kind of a few notes on the context of this ALICE measure. ALICE is a measure of financial hardship. So we have the federal poverty level, which is the same throughout the country, regardless of location, regardless of household composition. And federal poverty for a family of four in 2026 is about $33,000. As you'll see, the ALICE measure for Westchester and Putnam is closer to $140,000 for what someone needs to survive in our area. So very different from the poverty level. And this is important because if you don't have a good representation of how people are struggling, how many people are struggling, you can't do anything to address that problem. So ALICE is a tool that helps us understand just how many people are struggling, so that we can begin to work towards fixing it. Um, and just a note on how ALICE is calculated. The cost of living for each area is determined for each type of household. And then if your income falls below that threshold, which they call the ALICE threshold, then you are considered ALICE. So that includes ALICE as well as those in poverty. Next slide, please. ALICE faces impossible choices. So ALICE could be those who were doing all right, just barely getting by, and then one crisis comes along and all of a sudden they're not able to pay their bills. So this could be a loss of a job, a death in the family, an illness, some kind of catastrophe like your home is destroyed by a fire or flood, you're escaping domestic violence, or just something as simple as your car breaks down. And households that may have just been making ends meet all of a sudden are not able to pay their bills. And that's the case when they have to decide if they're going to pay the rent, if they're going to buy food, if they're going to pay utilities. So really choices that no one wants to have to make. And there's another kind of lower in that threshold group that is making those choices every day, right? So it's not one crisis, but it is all the time. They are considering and calculating, how much do I have, how much do I owe, and how am I going to make this dollar stretch the furthest? So again, these are people that are all around us, could be us, and just keep coming back to that 40% in Westchester and Putnam who are living in this type of financial hardship. Next slide. So let's get into the numbers. If you add the households in poverty and the number of households above poverty but below the ALICE threshold, again, in Westchester and Putnam, that's 40 to 41%. That is a staggering number. In Westchester, that's about 117 households, 117,000 households out of 377,000. In Putnam, it's 12,000 households out of about 35,000. So these are not small numbers. These are not insignificant percentages in our population. It's 4 in 10, 2 in 5 people. If we applied this to the number of people who registered for this presentation, out of that 350, about 140 of us would be ALICE. This is really just a very high number that continues in this trend. And I think many of us on this call are aware of this, but it's good to have the data to back it up. Next slide. So as we've mentioned, this burden is not distributed equally. Groups who are already marginalized are significantly higher ALICE populations and poverty populations than those who aren't. And we've highlighted a few of those here. So in Westchester, 60% of American Indian and Alaskan Natives households are ALICE, 58% of Hispanic households, 55% of Black households, 73% of households under 25 years of age, and 66% of single female-headed households. In Putnam, we again see people of color and single-parent households, 49% of Asian households, 48% of Black households, and 43% of Hispanic households are ALICE. 78% of single male-headed households with children are ALICE, and 85% of households under 25 years of age are ALICE. You can move on to the next slide. We also see that ALICE varies from community to community. So this is a map of Westchester where the areas with higher percentages of ALICE are in a darker blue. So you can see here Peekskill, Mount Kisco, Yonkers, Mount Vernon, all have higher percentages. And some of those communities are close to 60% of households being ALICE or in poverty. We also note here that the lowest percentage in Westchester is Scarsdale at 9%. And when you compare 9% to 60%, you might be thinking, oh, that's pretty good. But let's just take a minute to unpack that. Scarsdale is known as one of the most wealthy areas in the country, and almost 10% of people are struggling there. So this tells you that ALICE is everywhere. ALICE is in every community. ALICE, you might not think that there's ALICE in your community, but there is. And if we go to the next slide, we'll see for Putnam County, similar trends. Putnam has a little bit of a tighter distribution. The highest is Patterson with 50%. The lowest is Putnam Valley with 33%. But again, almost half of people struggling in certain areas, 30% struggling in others. This is a very, very common issue in both Westchester and Putnam. Next slide. All right, so this is the household survival budget that I was mentioning a few minutes back. And there are two sort of factors in the equation of economic hardship. There's cost and there is income. So this dives into the cost a little bit. On the left side of this chart, you can see the various expenses, and then across the top are the different types of household compositions. So for ranging from a single adult all the way to two seniors, you have various compositions of households. And so this then tracks the expenses for each of those types of households and tells you the total that they need just to survive. ALICE actually also has a thriving budget. So this is a survival budget. This is just basics, just essentials, just making it day to day, month to month. This is not holidays, birthdays, vacations, or those emergencies when your car breaks down or your house floods. This is just everyday expenses. And again, we see that Westchester and Putnam, you need about $140,000 for a family of four. That's with two adults and two children in childcare just to get by. And we use that household as a representation just to give an understanding of the context here. So again, $140,000 compared to the federal poverty level of $33,000. You can see that that poverty level is not so useful in really telling us who's struggling. I do want to highlight a few of these categories, and I don't think that they will be surprising to anyone on this call. Housing, childcare, healthcare, especially for seniors. These are some of the items that are really driving these high costs and keeping families struggling from month to month. You can move to the next slide. So this was Westchester, and the next slide is Putnam. And again, $140,000 needed for a family of four is really out of reach for a lot of households. Let's move on. So another indicator of cost, as Tom mentioned, we have rising prices. Since 2007, the Consumer Price Index, which tracks basics and luxuries, increased 52%. The ALICE Essentials Index only tracks basics, and that in New York State increased almost 80% since 2007. And for nationwide, it's closer to 70%. So New York State is actually seeing higher inflation in basics than the rest of the country on average. And again, the Consumer Price Index is often what's used to direct policy and programs, and it might not tell the full picture, whereas the ALICE Essentials Index, things that people are buying every day, food, housing, transportation, those things are much more expensive and getting more expensive faster than the other measure. Next slide. Also related to wages, we see that a lot of jobs just don't pay enough. So we don't have this data for the county, but we do have it for New York State. And we see that in New York State, sectors have up to half of their workers struggling to make ends meet. So some of the highest ones here, accommodation and food services, 52% of workers, transportation and warehousing, 43%, and retail trade, 40%. And that means that 40% of people in that entire sector are struggling. Um, and so this tells us that, again, this is an equity issue where there's a lot of variation sector to sector. Let's go to the next slide. Um, we know that there are occupations that are common across sectors. So think of something um, like uh, customer service, could be in healthcare, could be in retail. So it goes across different sectors. Here we see that for New York's 20 most common jobs across sectors, 35% of workers are struggling. That's 1 in 3 are struggling to make ends meet. Some of the highest percentages, home health aides at 71%, personal care aides at 60%, and cashiers at 60%. So extremely common occupations, and well over 50% of people are struggling in some of these jobs. We can move on. This graph shows financial hardship over time. So as Tom mentioned, these are long-standing trends. The top line of this graph shows the ALICE population, and the bottom darker blue line shows poverty. So you can see that ALICE has increased, this is Westchester, by about 40,000 households over this time, whereas poverty only increased by about 10,000. So more people are falling into the ALICE threshold over time than are falling into poverty. So again, this is a group that is often forgotten, but is actually growing faster than those in poverty. And if we look at Putnam, in the next slide, we see a similar trend. It's not quite as drastic, but still an increase for ALICE compared to poverty. And just a note here, as Tom mentioned, this data is from 2024. It takes 2 years to compile this data all across the country, analyze it, and create all of these reports. So there's a lag, and a lot has happened since 2024. We've had tariffs, we've had a war in Iran, and we've had a significant cutting of safety net programs. So when we get the 2026 data, we anticipate that there is going to be a sharp jump in ALICE and poverty likely. But again, just for everyone to remember that all of this data, this picture right here is not of today. This is of 2 years ago, and we expect the circumstances to get much worse, unfortunately. We can move to the next slide. So lots of data here. Again, we're trying to cover a lot in a short period of time. And Dante is going to share a lot about how you can use this data in your work, how this data is relevant to you and your community. But we also want to let you know that you can go to unitedforalice.org and really dive much deeper into the data than we're able to cover here today. So again, that's unitedforalice.org. And once you go there, you can view the data by different topics. You can also view it state by state. So when you go to New York State, you have all of these different tools here. On the left side of the page, you can see there's Dig Deeper with ALICE data tools that has maps. It has legislative area tools, different calculators you can use. You can plug in the different types of household compositions. So you can really customize it to maybe your clients, your programs, and see what the data tells you for your specific population. So we would encourage everyone to walk away from today understanding the big picture, but know that there's a lot more in terms of tools and resources that you have access to. And again, we thank United Way of New York State, United Way of New Jersey for helping to pull all this together. And with that, I'm going to pass things on to Dante, just reiterating one more time that everyone should remember 40 to 41% of our neighbors are living in economic hardship, that this number of households is increasing all the time. We expect that to happen, that increase to continue over the next few years. Costs are outpacing wages, and again, this is not distributed evenly. So groups that are already marginalized are likely to have much higher shares of ALICE in poverty. And with that, Dante will give us some hope for how we can use this data to make a difference.
Yeah, thank you so much, Avery, and thank you, Tom, both of you for presenting the data. So now that both Tom and Avery has set the stage for all of us, now the biggest question is how do we utilize the data? So for the purposes of my next few slides, I'm not going to keep you long, I promise, but for the purpose of my next few slides, I really want you to think about ALICE as a noun. Right. So we talked a lot about ALICE as our neighbor, as a caregiver, as our friend, family member, whomever it may be. But consistently, I want you to think about ALICE as a noun. So turning the ALICE data into action. Again, both Tom and Avery talked about the data. They talked about how this impacts our community, how it impacts the ALICE folks. But the biggest question is, what do we do with them? What do we do with the numbers that was just presented to us? So as nonprofit leaders and as leaders within this group, we can utilize data in a few different areas. First thing is really tell stronger stories, connect donors and funders to the people behind the numbers. Next is build stronger programs, use data to understand emerging needs, identify gaps, and design services that respond to today's reality. And advocate for change. Give legislators and local officials the evidence and stories that they need to understand what families are experiencing. And lastly, but of course not least, strengthen our impact. Move from simply describing the community challenges to developing solutions. So telling stronger stories. This is for our development folks. As you're as you are creating your appeals, as you are connecting with donors, as you are connecting with funders, whomever it may be, just always keep ALICE in mind. The ALICE data gives us the facts. Storytelling gives the facts meaning. So here, I'm providing you with some details as it relates to how we can utilize data from a fundraising perspective, how to tell the ALICE story, and it starts with the person. Introduce ALICE as a neighbor, as a parent, as an employee, caregiver, senior, or family. So we can connect their experience to the data. Show that one person's story represents a larger reality happening throughout our community. Protect dignity. Tell stories about resilience, hard work, aspirations, not just simply hardship, right? Make the audience see themselves. ALICE is not someone else, quote unquote. ALICE may be a co-worker. Well, that's actually no. ALICE is a co-worker, a friend, a family member, or a person helping us literally every day. And end with possibility. Move the story from here is the problem to what we can do together. So on the right side here, we're working through our annual appeal letter. So I just took an insert from it, literally from our appeal letter. So in it, it says, ALICE. She pours your coffee every morning before heading to her second job. He cares for the aging parent while working to pay his rent. Sorry, the words are a little small, so I'm trying to read through it. They are the child care provider who provides your family with a smile each day and goes home and wonders if they will have enough money for their groceries this week. ALICE is 41% of our community. So with that in mind, as we use this insert, we utilized Alice as a noun, right? So we used the three pronouns, she, he, they, within this insert. So again, utilizing the data that way is helpful in telling the story. So building stronger programs let data shape the solution. So I like to say to use the Alice report sort of as a needs analysis, and really understanding what's happening within our Westchester and Putnam communities. So the Alice data allows us to identify the gaps, look at where Alice households live, and where services, resources, or opportunities may be missing. Understand the barriers, explore how housing, childcare, transportation, food, healthcare, and other basic costs affect the people you serve. And lastly, design with people, not just for them. So combine Alice data with the voices and lived experience of your community when developing programs. So to the right here is really understanding the data, identifying the need, create the program, then identifying the impact. That's how we can utilize the data from a program's perspective. Advocate for change. This is probably one of my favorite. Just because turn the community data into a voice for action. The Alice data gives nonprofits and community leaders something very powerful, which is evidence. There's a joke there. So, using the Alice data to educate our elected officials, help legislators and local official leaders to understand who Alice is and what working households are experiencing within their districts. Make it local. Using the data to really talk with your local officials, and keeping it really hyper local, talking with your mayor, and having them understanding Alice as well. And then, of course, as you all know, make a clear ask in terms of what we are looking for. So again, utilizing the data, tell the story, help with policy, and help with creating change with your local officials. Strengthening our impact. So we're going to move from measuring activity to demonstrating change. So really just in the middle here, it's really just measuring more outputs, go beyond, go beyond, and really understanding the needs and the outputs within our community. And really track community change, right? We talked about the 10 years worth of data. And within the next, year, within the next 2 years, 3 years, whatever it may be, the data is going to continue to change. So it's important that we stay up to date with all of the data, just so we are aware and how we're telling the story correctly. And then strengthen partnerships. We learned this obviously through the lifetime of our nonprofits, but one thing that I learned through COVID especially is that there's power in partnerships, and that nonprofit organizations more specifically, we can't do this alone. So the power of partnerships is extremely important in how we connect and really tell the story, because the reality is we're all doing the same work in a different way. So again, understand the data, create action, create your outcomes, and then understand the impact. Sorry, the questions were just popping up there. And then lastly, really just to summarize everything from understanding to action. What will we do differently with the data? We have the data. We can tell the story. So, really, what's next, right? So the 4 points that I just mentioned: tell stronger stories, build stronger programs, advocate for change, and strengthen our impact. So with that in mind, I'm going to give it back to Tom to close us out and for you all to ask some questions.
Thank you, Dante, and thank you, Avery, for your incredible and informative presentation. As I said at the onset, the numbers are shocking, but if you're paying attention, if you have been paying attention, it should not be a surprise. We all have a role to play. Policymakers, community members, employers, aid to continue spreading the word about Alice so we can affect change, but B, also to humanize who Alice is. By its very definition, Alice are working families. We have to remember that. And when any society has 4 in 10 of their working families unable to make ends meet, something's wrong with the soul of our communities, of our nation, of the societies that we are a part of. There's a number of resources that we want to amplify. Again, first and foremost, visit unitedforalice.org. United for Alice was created by the United Way of Northern New Jersey. That's where all this research is done. Avery had shown you a screenshot of things you can do on this website. There's also a list of the methodology of where all this data comes from. So you don't have to just trust the three of us, but it comes from places like the U.S. Census Bureau, the University of Southern California Center for Economic and Social Research's Understanding, the Federal Reserve Survey of Household Economics and Decision Making, and a number of other reports. All this information is culled together, it's put together, and then the end results are these Alice reports, not just in our community, not just in New York State, but in 40 plus communities throughout this country. The other thing I want to reiterate, that I want to say again, is that this is not a political statement. This is an economic statement. And again, the fact of that is that these numbers are all going in the wrong direction everywhere. For example, New York State as a whole, Alice and poverty is 48%. And that has been growing over the past dozen years or so. It's growing everywhere, not just in Westchester, not just in Putnam or Nassau or Dutchess or Greene or Columbia or any other communities. It's growing everywhere in this country. Now, let's answer some questions that are in the chat. Someone asked what trend stands out the most. Frankly, it's the fact that it is growing, that poverty in Westchester has grown 33%, that Alice households have grown 50%. And like I said, that those numbers are growing everywhere in our communities. Another question that came up was, will there be a list of resources shared in this presentation? So at some point, if not today, but definitely this week, everyone who's registered, everyone on our email list is going to get an email with a link to this recording and all of the various Alice reports, not just the Westchester report, not just the Putnam report, but the New York State report as well as the link to the unitedforalice.org website, so that you all can go in and look at individual. There's even a place in that website to look at individual zip codes and understand what the Alice population is and what those numbers are. So yes, you'll get a list of all of those things. Is there information about the kinds of job opportunities that exist in each county to evaluate whether the local economy only offers poverty wage jobs, or if it has a living wage jobs available that we can get people into? So the scary thing, again, is that it's not Westchester. It's not Putnam. It's everywhere. You may not know this, but more than half of the jobs in this country are hourly paid. More than half, and less than 25% of working age adults had the security of a full-time job with a salary. And 37% entirely are not in the workforce, either because they're unemployed, they are disabled, retired, or too young. We live in an echo chamber. It's the social media algorithm. We all know people who are working annual salaries. We are most likely annual salaried individuals. We are in the 25%. It's more than half are working hourly jobs. Avery had shared the statistics of what those jobs are, what they look like, what industries they're in, but they're everywhere. They're in the nonprofit sector. They're in the government sector. They're in the for-profit sector too. But all of these jobs are everywhere, and it's not just in Westchester and Putnam counties. I've been monopolizing. At any point, Avery, Dante, just jump in and answer questions. I'll take another one real fast, but Avery, go ahead.
I was just going to say, I see the next one is about SNAP. So I looked up what the SNAP household income requirements are. For a family of four, it is $41,000, $41,796 for a family of four. So again, remember, poverty level for a family of four is 33,000. So this is slightly above that, but nowhere near the 140 that is required for a family of four with two kids in childcare. Even a family of four with two kids not in childcare is, I think, something like 114,000, right? So that's the difference, is that so much of Alice does not qualify. A few, right, between that 33,000 and 42,000 or so will qualify, but so much of Alice above that won't qualify for help.
Another question was, will you share the slides? Yes, it'll all be a part of the package that we're sending out afterwards. Janine, excellent question. We would love to tighten up that timeline. The fact that this data is 2 years old. So I will say it's about 18 months old, because we've had the report for about a month now, 6 weeks or so. So it was completed in early June, late May, early June. So it's about 18-month-old data. They've tried. It's really hard. Most of these federal level numbers take a year to be published. So they're really working very hard at United for Alice to pull this all together in a 6 to 9 month window. But a lot of this data just isn't compiled right away. So how is the United Way educating federal policymaker? The United Way worldwide, as well as United Way of New York State and many local United Ways, are engaged in advocacy efforts everywhere. The local level, the state level, and the federal level. We regularly meet with legislators to educate them about the ALICE numbers. Obviously, we have lobbying firms, advocacy firms helping to communicate that message, as well as PR firms that are trying to educate legislators about these needs. At the end of the day, there is traction in understanding and using ALICE as a metric, but whether it's the ALICE report, whether it's other incredible reports that are out there by some of the organizations, even in our community, Westchester Children's Association, the New York Community Trust Westchester Division, so many other reports that are out there all say the same thing. I don't think this is a question of people not seeing the data. This is a question of people fighting over the best way to affect the change as it relates to the data. Another question was, how does the U.S. compare to other developed nations with regards to those characterized as ALICE? This may come across as pithy. I'm concerned with the U.S. Unfortunately, I don't know. I've not looked at global data. I'm focused on our communities and what's going on in our country. Someone may have that. We unfortunately don't have access to that. Someone asked, you mentioned that the ALICE data is already 2 years old. How should we think about that lag when making decisions about policy or other programs and services today? Well, I'm going to be blunt. The numbers are going to be worse. They're going to be worse when we have 2025 data, and it's going to be worse when we have 2026 data. You cannot have a war in the Middle East. You cannot have tariffs increasing the price on things, and not have impact on affordability. These are facts. Both parties have acknowledged this. So affordability is going to be harder during those two time periods, 25 and 26. So there's going to be more need for many of us. And there's not going to be an increase in programs and services offered, especially as a result of federal reimbursements, because as Avery just pointed out, what SNAP benefit thresholds are. It's not going to extend to 200% of your federal poverty level, or 300, or even 400. 400% still doesn't get to the top of the ALICE threshold. So we're still going to see a lot of people that are struggling.
Yeah. And Tom, can I mention something with that as well. To that question more specifically, and utilizing Alice, Alice should be utilized as a tool, right? So there are other tools that's available. I don't know if you hear an echo because I hear myself. But there are other tools that are available to help tell the story similar to Alice. And when utilizing that data, thinking about like from an organizational perspective, like, organizations typically do like a strategic plan maybe every 3 to 5 years, or they, check the pulse around their strategic goals and objectives every 3 to 5 years. I'm only saying that because we literally just did that, or we're literally in the process of doing that. So, if you are like in the process of looking at your strategic plans as it relates to your goals and objectives, utilize Alice this year as a part of making your decisions, right? Because again, you can utilize Alice as a tool as it relates to like a needs analysis, understanding what's happening literally hyper local. And when you create that plan, you create that plan for the next like, maybe 3 to 5 years. And then us at the United Way, we're going to do this same song and dance within the next 2 years, right? So we will be here presenting you with the data that and the unfortunate part is that the data, to Tom's point, will get worse. So utilize this as a needs analysis more recently within the next few months if you're looking at the goals and objectives within your organization. Sorry, Tom.
No, thank you. Thank you, Dante, for adding that. Let's see, there's another question here about is there a possibility that the federal government would stop gathering some of the vital data used in this report? I can't really speak to supposition. I can say that one of the most important drivers of this report is the census data. There's a dozen other data points, but it is one of the most important. And we already know that the federal government has tried to change on numerous occasions how the census data is gathered, the questions that are being asked on the census data, and so on and so forth. So while I don't necessarily think the data will stop, some of the data points may disappear or may be changed, which will then result in United for Alice publishing different data sets or using different data sets and publishing different benchmarks as we go forward. But we will see. We'll certainly see. Let's see. Will United Way lobby corporations to raise hourly wages? I cannot speak for what other United Ways are doing in their communities or what United Way Worldwide has done. We have been very vocal about livable wages. We raised the starting wage of our staff members about 5 years ago to keep up with a couple of big nonprofits in Westchester. Shout out to Feeding Westchester. We've done that as well and continue to raise that. We try to lead by example and less by browbeating, but we have communicated this message to corporations everywhere, and probably on a, if not weekly, every other week basis, we are giving a presentation to a different corporation, a different business, a different entity somewhere in Westchester and Putnam County about the needs of the Alice population. And we're always happy to give that presentation. If you want to invite us to come by, we're happy to do that. Any other questions? I think we've gotten through everything in the chat. Thank you to Laura Rossi, Adam Rabinovich, who shared some resources in the chat. Very much appreciated. These are also additional reports. Again, don't just use the Alice report. Use the Poverty Pulse. Use these other reports as well. They're going to be very helpful as you're making a case in terms of communicating to policymakers, community members, employers, donors, etc. And I think that's it. Well, unless there are any other questions, we're going to give everybody about 5 minutes back of their day Has the Business Council shown any interest in this? Yes, the Business Council was one of the promotional partners in helping to share this information. They're very aware of the ALICE data and has been extremely helpful in this process. So can't thank them enough for their participation and their support. So unless there's anything else, thank you, everyone. Thank you for joining us today. We really appreciate your time. Feel free, as I said at the onset, share the ALICE report. Put the ALICE report on the website. Reference it. Reference some of these other really incredible reports and data points out there in trying to change the narrative on what the need is. The need is not poverty. The need is ALICE and below. And it's a massive number in our community, and it's growing. So thank you, everyone. Thank you for being here today, and keep doing the incredible work that all of you are doing in this community. And if you're not doing that work, please get more involved. Help support, help make a difference in our community. Thank you, everyone. Have a great day.